So today's video is going to be about cranial nerves. It should be nice and short and sweet, but unfortunately, there's not a lot to really understand. It's another kind of memorization thing. Here are the 12 cranial nerves. This is what they do. Now, we will do a lab where you'll get to test some of these, on your partner and, kind of analyze a little bit of patient things. A patient presents with this or this. But again, this chunk of information is just going to really be like a memorization part real quick. Okay, so let's just start with we're going to name them first and then we'll talk about what they do. So the cranial nerves are named with a Roman numeral and an actual name, and you'll be expected to do both of them. And they come in pairs, and we have 12 pairs of them. Officially, they are not part of the central nervous system because they are not the brain or the spinal cord. They are part of the peripheral nervous system, but we're going to talk about them now since we just talked about the brain, and these are nerves that are exiting off of the brain. Okay, so our first one is this pair right here. So this is Roman numeral 1, and this is the olfactory nerve. So when we get to function, hopefully you'll have an idea of what this one does. Okay, and so again, we have a right and a left, and that's why there's two of them. So that is this right here. So there is cranial nerve 1, olfactory. And they're actually just going to work their way down. So as we move down here, this will be cranial nerve 2. It's cut off. It would keep going like this towards the eyeballs. Okay, but this is cranial nerve 2, this one right here. And so Roman numeral 2. And this one is called the optic nerve. So cranial nerve 2 is our optic nerve. And as we just said, it goes to the eyeballs. So hopefully you are thinking that that one is going to be doing vision. Okay, so right below it, we have cranial nerve 3. So again, in pairs there is cranial nerve 3. Cranial nerve 3 is the oculomotor nerve. Okay, motor move, oculo eye. Again, hopefully we have a guess at what that one does. Okay, our cranial nerve 4 is the small one just below cranial nerve 3. So right there. Cranial nerve 4 with our Roman numeral 4 is also called the trochlear nerve. Cranial nerve 5 is this big giant one next to it. Okay, so that whole nerve there is cranial nerve 5, which is the trigeminal nerve. Cranial nerve number 6, so we jump back to the middle here for cranial nerve number 6. Cranial nerve number 6 is called the abducens nerve. So 6 is the abducens nerve. Cranial nerve number 7 is this one right here next to it. So again, I'm just working our way down number-wise. So number 7 there. Cranial nerve number 7 is our facial nerve. So it's going to go towards the face. Okay, right below it here, we have cranial nerve 8. So there's cranial nerve 8. Cranial nerve 8 has a nice long name. It is our vestibulocochlear nerve. If we were doing the ear, this would make a lot of sense. This one brings us information from our ear, and there are two parts of the ear, one called the vestibule, one called the cochlea. So our next one down then, cranial nerve 9. So cranial nerve 9, right below it. Cranial nerve 9 is called the glossopharyngeal. Practice saying these names. It will help you remember them. Okay, so headed out to 10. So 10 is this one right below 9. So right there. Okay, flip over to the other side, get some room. So 10 is just an X. So 10 is our vagus nerve. Below it, I have cranial nerve 11. So this one here below it. Cranial nerve 11 is going to be our accessory nerve. Sometimes it's called the spinal accessory nerve. And then our last one is the one that's kind of on top there. Let's see if you can see the yellow. So this one right here, that one there is cranial nerve 12. So 12. And that one is called the hypoglossal. So I'm going to give you a quick mnemonic to help you try to remember all of these names. It's easiest usually if you try to remember them just in order and you just constantly run through an order until you get to the one that you want. Okay, old, opie, occasionally, tries, trigonometry. I know this one's going to be kind of long, but just bear with me here. Tries trigonometry and feels very gloomy, vague, and hypoactive. This one is not perfect, but what it does is it does help kind of distinguish some of the, because like for instance, the first three all start with O, and then you've got two that start with T. So it helps kind of distinguish them by containing multiple letters of the particular nerve name. For instance, old, right? Olfactory, opie, optic, oculomotor, I've got my OC, trochlear, I've got my TR, trigeminal, I've got the whole trig part there. Okay, abducens, facial, vestibular cochlear, so I get the VE there. Okay, gloomy, vague, almost the entire nerve name is in there. And there's my accessory and hypoglossal. Making up your own would make a big difference as well to help you remember it. But making up your own will help you remember it and will be very beneficial to you. Remember, the funnier you can make it, the better it will help you remember it. But don't go so random that you have no idea what anything means anymore. Okay, so you may want to have take a second, pause it, and fill in the first part of your chart real quick, the Roman numeral and the name. Okay, so we're going to run through functions real quick. So hopefully it's pretty obvious that our function of the olfactory nerve is for smell, and our sensory motor both part is related to this function. So for olfactory, it would be sensory. And I'm going to shorten this to S, M, and B as we go through this. Okay, our optic nerve helps process sight information. So that would be sensory as well. Our ocular motor is going to do eye movements. It's going to, there's going to be multiple nerves that are going to control the movements of the eye. This is going to do the bulk of it or the most of the eye movements. It's going to, I don't know if you remember when we did the eye, but we talked about the 6 muscles on the eye. And these are going to control, this ocular motor is going to control 4 out of 6 of those muscles. Okay, so it's going to be motor. My trochlear is going to do more eye movement. Okay? In particular, it's going to do that superior oblique muscle. It's going to be that's the only muscle that it's going to do that with. So again, I'm going to have motor here. My trigeminal is going to do sensation to the face. So basically feeling things touch your face, pressure on your face. Okay? And what we call muscles of mastication. Mastication is chewing. So these are the muscles that help pull your jaw closed so that you can actually chew. So because it's doing sensation and it's doing muscle, it's going to do both. So both sensory and motor. The abducens does eye movement again. The abducens is going to do that lateral rectus muscle. And so all of those other muscles, superior rectus, medial rectus, inferior rectus, and the inferior oblique, those are all going to be oculomotor. So abducens and trochlear just do one muscle apiece. superior obliques for the trochlear, lateral rectus for the abducens. So again, that would be a motor nerve. Our facial nerve, this one is what's going to allow you to do facial movement and expression. So smile at people, frown at people, make goofy faces. That's all going to be with this facial nerve. The chewing, the jaw muscles are going to be that trigeminal nerve. And it's also going to do taste on the anterior 2/3 of the tongue. So because again, we're doing a motor and a sensory function here, this one would be classified as a both type of nerve here. The vestibulocochlear is going to gather information regarding hearing and balance. Again, I told you it's coming from the ear. So this one is sensory information. The glossopharyngeal is going to help you swallow, which would be a motor function. And then it's going to do the taste on the posterior 1/3 of the tongue. So because we're doing both a motor and a sensory function, again, this one would be both. Your vagus nerve is going to do autonomics in the trunk. So the chest, the abdomen area, that's what we mean by the trunk. So autonomics in the trunk would include things that involve digestion, movement of food, lungs. So it's going to contain both sensory and motor information. The accessory nerve is going to control some muscles. So it's going to help raise your shoulders up, and it will help rotate the head. Remember your muscle names here. We're talking trapezius and that sternocleidomastoid, that SCM muscle. So because it is controlling muscles, this one is a motor nerve. Okay, and our last one is hypoglossal. Hypoglossal is going to help you move your tongue. And so again, because it is, so it looks like the microphone dropped out, but I was just saying that because it's a motor function. So the final thing we have for you is for a mnemonic to help you remember sensory motor in both. So I gave you a mnemonic for their names, and you're going to see the mnemonic pop up. I had already recorded this, but for some reason, again, it looks like the sound dropped out. So your mnemonic here, some scientists make money, but my brother says beautiful blondes make more. So we will do some practice worksheets with these. We'll do the lab, and you'll need to make sure you have these memorized in time for your summative.